What's up everybody? Sean here with another Live to Roll video. So this video is going to be actually just on suprapubic care for your suprapubic catheter. And also I'm going to give a little bit of information on the reasons why I got the suprapubic and just some basic information on the catheter, what it is if you don't know. So we'll actually just jump straight into that. If you don't already know, a suprapubic catheter is a surgically placed catheter in your belly. It's a little like centered below your belly button, above your penis, and it's just kind of goes directly into your bladder. So that's what a suprapubic is essentially. And if you want, I have a page on my website you can check out to see some more information, basic information and stuff like that. So we'll just get into the care stuff for now. So for me personally, I have a super sensitive bladder. So I need to do everything I can to maintain my bladder health and my catheter site health and just keep a healthy overall urinary tract. So basically what I do for the site, I actually clean the site morning and night. And one of the things I do for cleaning the site is I only use baby wipes. And if I don't have baby wipes, if I'm traveling or something and I run out, I just use a washcloth and soap and water. I do not use alcohol or any harsh cleaners because it's just really harsh on that skin right around the catheter, because it's still a little, it's like really kind of open, like the wound is sort of an open wound. So if you're jamming alcohol down in there all the time, like it is good, it'll clear out bacteria or infection. So like, yes, that's good to do sometimes. You can actually use catheter, I'll use alcohol swabs on my catheter, like on the actual catheter, but not on my skin. So like I'll have my caregiver, like occasionally if I need it, just wipe the catheter down with an alcohol swab. But even that I don't do much as long as I'm showering and keeping everything clean. So that's my basic care maintenance tips for keeping it clean. Just no harsh cleaners. And talk to your doctor if you need to. Like, I am not a doctor. This is just from my experience over the last 16 years with the suprapubic. And just everything I've learned through trial and error. So another thing is to maintain the catheter site health is I gauze it. I use a 4x4 gauze. And I put that on every morning and then take it off every night. I don't use one at night. I just clean the site before I go to bed. And then right when I get up in the morning, before I even start stretching, I'll wipe it again with another fresh baby wipe and clean it one more time in the morning. And then once I'm done stretching and get out of bed, if I'm not showering that morning, I will clean it again one more time right after I change my bag. After I've already changed to my leg bag, I will clean it one more time and then apply the gauze to it directly after cleaning it. And another thing about the gauze I don't use just a regular cheap gauze square. I use pre-cut gauze squares, and they're actually antimicrobial. So they actually already have a coating on them that's like antimicrobial, antibacterial. So it's going to keep infection from coming as easily. And that has really, really helped me. So before I started using those, I actually had a few different site infections. So I actually had a skin infection at the site of my catheter. And it was really red, really irritated. And actually I have a friend that just recently was dealing with this and sent me pictures because he was curious about if it was normal. I told him to see his doctor immediately. But this is actually a picture of what his looked like. And so he ended up getting it really infected and then also getting a skin ulcer around the site with skin breakdown. So that's not good. That's 100% what I try to avoid doing. And so that's why I made this video, because I'm just trying to give out some of the care tips that I give. And actually you can check out what my catheter looks like. And hopefully it's not too much for you guys to see this. The first one was probably a lot worse. But my catheter, this is what a healthy catheter should look like, the site. Occasionally I get a little bit of redness, I get irritation, especially if I haven't showered that day. And I'll just make sure to wipe it really good and just make sure to keep it really clean. That's my number one thing, is just keeping the site clean. That's the best advice I could give you for sure. So the gauze helps. I know a lot of people that switch morning and night gauze, so they'll actually just replace their day gauze and put a new one on at night. I personally just leave it off, but it's worked for me. So it's just finding what does work for you, what's going to help you out. And so also, if you don't have antimicrobial gauze already, and not even pre-cut. One, try to avoid the really loose gauze that's kind of like, you know, you can almost see through. It's more like the cheese paper. Don't try to avoid that stuff, because at least for me personally, the little pieces would get around the catheter. It kind of would fray and come apart, and they just never seemed good. It seemed way more irritated. When I was using the things like that is when I was getting the skin infections around my site. So try to use a better gauze, like a little bit just thicker, more. I'll actually show you guys. This is the gauze I use. I'll pop up a picture right here, so you guys can check out that. And they have another one that's the same brand and non-antimicrobial. So if I have those, if I run out of the good antimicrobial ones, I will actually use the non-antimicrobial. They're still pre-cut 4x4 quality gauze squares, and I'll actually put a little dab of neosporin on the gauze right around the catheter hole site, like right where my catheter is going to come through it, and basically kind of creating an antimicrobial layer. Just so I don't put it directly in my catheter or on the site, like which it does rub in there once the gauze is placed. But that's what I will do. I'll have just a little tiny piece, like it doesn't need a lot, just right around so that it spreads right around the opening in the gauze, so where your catheter comes out. And that for me is what I'll do just to try to keep my bladder health up. And sometimes that even helps if I do get a lot of red irritation. If I do the neosporin for a couple days, even with the antimicrobial, a lot of times that makes that irritation go away. It kind of eases it up. So that's just another tip that I've found over the years that's helped me. So another thing to keep your just overall bladder and the catheter, you know, free and flowing and stuff, but overall bladder health going, is flushing the catheter. So I personally flush my catheter every other day, and I have a video, you can check out that link for the flushing of the catheter, what I do. I use a mix of saline and acidic solution, because the acidic solution is a little harsh by itself in my bladder, but it does really help break up stuff on the catheter wall, and also break up the you know, any bacteria and stuff that's in there. It helps with pulling that stuff out. So I mix it 50-50 with either sterile water or saline, just because that just to dilute the acidic effect a little bit. So that's another thing that I do, and I have somebody help me with that flush. And like I said, you can check out that video. Okay, so as far as like maintenance and changing the catheter, I change mine every 3 weeks. I used to do it once a month, but I was having issues like the final week or so where I was just really irritated. I was getting a lot more bladder spasms. I could just tell my bladder wasn't feeling very good and wasn't liking it. So I switched to the 3 weeks, and 3 weeks has actually helped me a little bit. By week 3 I noticed the catheter starting to wear out a little bit and get a little worn down. So that's another thing also. I only use latex catheters. And that's because, like I mentioned at the beginning of the video, I have a very sensitive bladder, like really sensitive. So the silicone ones, which is what a lot of doctors are using now, or silicone coated, so they're latex underneath but silicone coated around the outside, those are okay. They're a little softer, but the thing is the silicone's way more rigid. It doesn't bend, doesn't flex, and I get AD like crazy. Anytime I've had one of those in my bladder, I'm peeing on myself. It's causing me so many bladder spasms. I'll get some flow through the catheter, but a lot of it's just kicking out because I'm peeing on myself everywhere because my bladder is spasming so bad and I'm going through AD. And it's just not fun for me. So I found that out early on, that I can't use silicone or silicone coated. So I have to use the latex only because it's just a softer, more pliable catheter, and it seems to work with me better. And even with the latex, my first 24 hours of a change, when it's still kind of new and like in there and adjusting and just a shock on my bladder, I will be peeing on myself probably for that whole first day. So what I do for that, random extra tip here, is I keep my bed bag on. I never do the leg bag the day of the change, or a lot of times even the day after the change. I'll try to keep a bed bag because it's just more free flowing and less stress on my bladder. So yeah, for that first day or so of the change, I will actually keep my zipper unzipped and a towel, like, so I'll keep, because I'm going to be leaking pee out of my penis. That's what's going to happen. My bladder kicks off and just wants to like empty and pee. I get some through the bag and some that I'm just peeing out. So what I'll do, because I don't wear diapers or don't wear any of that kind of stuff. It's just that's just my choice and my preference. So what I do is actually just will keep my shorts unzipped for the day and keep out of the zipper, and so I can pee into a towel, and I'll keep like a medium-sized towel with me on my lap, and I'll pee into it, and after I pee a couple times into it and it starts to get wet, I swap it out for a fresh one, and I just keep throwing them into my bathroom. So by the end of the day, I have like 6 or 7 pee towels, which is a pain in the ass I have to wash, and some of you might think it's easy. I mean, even if you, I don't know. I just don't like peeing on myself. I don't want the pee on my skin. I don't want to be sitting in the pee. So that's my solution for it. I just try to pee directly into a towel so it doesn't get under me, and then I can take that off, get rid of it, and have a dry lap, new towel, bam. So that's my extra little tip. And so on the frequency of changes, real quick, we'll get back to that real fast. I do it every 3 weeks, used to do it every 4. I know people that do it every 2 weeks because they just need to change that often. And I also have met people that change it every 4 to 5 months. And that's with a silicone one. The silicone doesn't deteriorate as much and seems to work better. So if your bladder can handle the rigidness and it doesn't bother you, it might be a better solution, at least as far as like, sterile and keeping the catheter in good shape for longer. So that's that little thing. So another thing that I do for just my regular maintenance stuff that I'm doing is actually I get an ultrasound every 6 months on my bladder and kidney to make sure I have no stones or anything like that. And then once a year or so, I'll usually get a cystoscopy. But for me, like I get really high AD triggers very easily, sensitive bladder like crazy. So I can't do those in the office. I actually have to go to the hospital, be put under, and then do the cystoscopy. So that's one of the reasons why I don't like doing it. It's more just the going under. If I could go into the doctor's office and just have them do it real quick and it didn't affect my body like super bad like it does, then I would just do that. And I'd probably do it more often. But I hate having to go under anesthesia and get put out for, to have them just peek in my bladder for a minute, stick a scope in my pee hole. So that's another thing that for maintenance, some tips that I would suggest. And I'm sure, talk to your urologist. Make sure you have a good urologist that knows a little bit about spinal cord injury, at least catheters. So that is a very helpful thing to have. So that's about it for my tips, I guess, you guys. And like I said, you guys can check out on my website. I have a page now with just some of these same tips, some pictures and different things of irritated catheter sites, what my healthier catheter site looks like, and just basic information on how to care for it and stuff like that. So check it out. And like usual, guys, if you're not already subscribed, please subscribe to the channel. If you like the video, please click the like button. Any comments or questions, leave them down in the comments below. Follow me on all social media at Live to Roll, pretty much everywhere. All right, everybody, let's get a fist bump. Live to roll.